and its tools. And we look forward to hearing your insights, Dr. Roque.
Thank you for inviting us to this webinar. I represent PSLINK. We are a national umbrella federation of unions of public service workers in the Philippines, and we are affiliated with the Public Services International, the Global Union Federation of Public Workers. Health and care workers make up a substantial number of most government workforces across the world, and PSI has a long history of organizing health and care workers into unions, pushing for enforcement of standards and better rights protection. Our health and care workers serve as the backbone of our health system. There can be no quality health services without health workers' rights. But in every part of the world, there are persistent gaps in the protection of healthcare workers' rights. And it is the women who make up the majority of health and care workers, our nurses, our community health workers, our caregivers, who suffer disproportionately when wages are low, when jobs are not enough, when jobs are informalized, when adequate PPEs are not provided, when staffing ratios are unsafe, when working conditions are unhealthy and dangerous, when care work is not valued properly, when care work is not recognized as work. And in many areas, public health care workers are denied their fundamental rights to freedom of association and collective bargaining. This is absolutely unacceptable. The right to organize and bargain is so fundamental in realizing all other rights. The lack of union representation, whether through explicit prohibitions or through intimidation and other disincentives, is a key barrier to decent work for health and care workers. And when health and care workers report wrongdoing and unlawful practices, they often end up suffering from retaliation for lack of whistleblower protections, law, and enforcement. Rights violations against health and care workers can happen anytime and anywhere, and it's important that standards are in place to ensure that we are protecting the people who are responsible for providing the health and care needs of everybody else. By ensuring robust legal and policy environments, we are protecting not only their labor rights, but also the right to health care of everybody else, including the most marginalized sectors of our society, the youth, women, elderly, persons with disability, persons of diverse socioeconomy, and the poor. It is when workers unionize that they are able to fight for their rights at work, ensure implementation of policies, and bargain for better conditions for patients also, including improved staff-to-patient ratios and life-saving interventions. As the Global Federation of Health and Care Workers, PSI is leading efforts to ensure fair pay, decent work, equality, and non-discrimination in the healthcare sector through organizing unions, building workers' power to represent, negotiate, and lobby for their rights. In the Philippines, despite the killings of unionists, harassment, red tagging, and other attacks on freedom of association, making our country one of the top 10 worst countries for workers in the world, PSLINK, together with the other PSI Philippine affiliates, have successfully lobbied for the ratification of important conventions on occupational health and safety and elimination of violence and harassment in the world of work. PSLINK also compelled the government to raise the salary grade of nurses due them after filing a petition at the Supreme Court. Sorry, please, yes. So those are just some of the slides showing our actual actions. And as the Philippines is also a major country of origin of migrant health workers, we have been leading efforts to promote rights-based bilateral labor migration agreements, ensuring fair and ethical recruitment practices aligned with the WHO Global Code of Practice on the international recruitment of health personnel. Next slide, please. Next slide. Across the Asia-Pacific region, PSI affiliates are showing how healthcare workers are organizing to win. The Maldives Health Professionals Union has recently won significant pay increases for health support staff. PSI is also organizing community health workers who are often marginalized, unpaid, and excluded from labor laws and social protection. PSI's recent success in organizing the first National Community Health Workers Union in Pakistan. Next slide, please. Next slide. Oh, and this, please move back. Oh, and the and the that shows you the photo of yes, okay, so that shows the photo of where the PSI affiliate in Pakistan organized successfully 20,000 community health workers in Pakistan, the first national union. And then PSI also successfully the affiliate in Nepal also successfully negotiated for community health volunteers to be recognized as workers with rights. These are testament to how unions are making real changes on the ground, leveraging international labor standards and improving the lives of our health and care workers, leaving no one behind, including our community health workers as well as migrant healthcare workers. The Global Care Compact and assessment tools are very important tools, and they come at a crucial time when health and care systems around the world are grappling with multiple crises, from pandemics to extreme weather events and disasters due to climate change, to social and economic inequalities, to aging population, to rising wars and conflicts. But just like any other tool, they're only effective when they are used. And PSI, which has actively contributed to the development of the Care Compact from the beginning, is very much committed to using it, leveraging it to build workers' power. As public sector unions, we will continue fighting for workers' rights and social justice for all, and put people over profit. Thank you very much.
Thank you, Dr. Roque. It's great to see that you're fully behind as you've been contributing throughout. I'll turn directly, after highlighting the fact that we are really enjoying